If you're on any type of blood pressure medication, amlodipine, lisinopril, hydrochlorothiazide, or any blood pressure medication like that, here's something that your doctor probably never explained to you in a 15-minute visit. Your blood pressure isn't high for just one reason. It's high for three different reasons. And the top three reasons are stress, sugar, and sodium. Okay, stress, sugar, and sodium. I call it the blood pressure triangle. And today I'm walking you through 8 different herbs, one at a time, mechanism by mechanism, that researchers have studied across all three corners of that triangle. It's not a quick list, the actual science behind each one, so that you understand exactly why it's in this formula that I have created. And it's not just any old herbs that I've thrown together. This is studied and it's specifically targeting the causes, the top three causes that I see over and over and over again in my clients, in people that I'm coaching. And so that is what we are talking about today, is these 8 different herbs designed to lower your blood pressure naturally. My name is Joel. I'm a registered nurse and a naturopath, and I've had 20 years experience in ICU and emergency rooms. I've given IV medications over and over and over and over again, popped pills into people's mouths to drop their blood pressure in real time, especially people that are like in hypertensive crisis, have preeclampsia, patients with heart rates over 150. But after 2 decades of watching this cycle over and over and over at the bedside, it's taught me that pressure won't come down, is often a problem that I see people come in with. They just come in and they say, my pressure just won't come down, no matter what I take, no matter what I do. And what I'm finding in my coaching is that it's always one of these three problems that you are dealing with. And so that is what we're talking about today. The three problems, and then these 8 herbs that address these three problems specifically. So, quick framework before we get into the herbs. Stress raises your cortisol. Okay, that's the top of the triangle. Stress raises your cortisol, which tells your kidneys to hold on to sodium, and that raises your blood volume. So that's like putting more fluid into a small area of blood vessels. And when you have more fluid in a confined space, physics says that the pressure goes up. Okay. Sugar, this is the second point of the triangle, spikes insulin, which does the exact same sodium retention trick, just through a different door. So it's pulling sodium so that water follows it, so that it will dilute your blood and allow your blood sugar to go down. Okay. I know this is a lot of information. I'm going to try and make it as simple as possible, but I need you to understand this foundational principles before we get into the herbs, so you know exactly what the herbs are targeting and why. And so the third corner of the triangle is sodium, specifically your salt to potassium ratio. Okay, so your potassium and your salt, they work on like a seesaw. When one goes up, the other one goes down. All right. So that ratio determines whether your kidneys correct for either one. So all three corners point at the same blood pressure switch. That's why treating just one corner so often stalls. It doesn't work. Your pills may work for a little while, but your pressure just keeps rising or doesn't change because you have these other two corners of the triangle that you haven't addressed. Everything I walk you through today was chosen because it touches at least one of these three corners, and several of these herbs touch two or more of the corners. So if you want the exact blend with all 8 of these in the right ratio, this is the site here. If you can see that, I can't talk about it online, but I want to make sure that you get the site. Go there and check it out. All right. So I'll bring that link up several times in this video, but in the meantime, let's get started. All right, hibiscus. Hibiscus is the #1 herb that I put in here. Hibiscus is the most studied botanical on the planet for blood pressure. And many of you who are trying to work with your blood pressure naturally have taken hibiscus tea or on hibiscus tea. It's great stuff. I've gotten a lot of great feedback about taking hibiscus. So specifically for lowering systolic pressure or the top number. A randomized controlled trial out of Tufts University looked at this directly. And there's multiple studies, multiple meta-analysis studies that have pooled all this data together across thousands of participants with consistent results, all saying the same thing, that hibiscus is a great ACE inhibitor. So ACE inhibitors are like lisinopril, anything that ends with PRIL, blood pressure pill you're on, is an ACE inhibitor. So if you're on lisinopril, enalapril, or any of these prils, those are all ACE inhibitors. It's a class of blood pressure medication that works by relaxing blood vessels instead of forcing them open. Okay, so hibiscus appears to interfere with that same angiotensin converting enzyme pathway, ACE, which is angiotensin converting enzyme. It's a pathway that hibiscus works on, just like your prils, okay? Just like your prils. That's why researchers keep coming back to hibiscus. They keep coming back to it because it's so researched and so proven to be the exact same pathway. It's also got a mild diuretic effect. So if you're on a water pill, it helps to reduce some of that extra fluid in your body as well, just like your Lasix and your hydrochlorothiazide or anything like that. So less fluid volume moving through your vessels means less pressure against the walls. Okay, so when you have less volume, your pressure goes down. So where hibiscus fits on the triangle, it's primarily the sodium and the fluid volume part of the triangle. Works through the vessel relaxation rather than sedation or stimulation. So this is one corner of a 3-corner picture, and it works alongside, again, disclaimer, all of these herbs that I'm talking about, this tea that I'm talking about, works alongside what you're already taking for your blood pressure, okay? Not instead of, because I don't want to get you in trouble with your doctor. I don't want to be in trouble with your doctor. We want to work with your doctor using these natural methods. And as you take these herbs, whether you take them individually, whether you take them in a tea combination, you want to stay on your blood pressure medication while you monitor your blood pressure, and you're going to notice your numbers start to go down. And as your numbers go down, you are going to find that your doctor is interested in lowering the amount of pill dosage that you're on, either cutting the dosage in half or taking you off them for a period of time, just to see if your blood pressure is actually normalized, okay? So once again, there's the link if you'd like to take a look at this one. It is crafted by me and my wife and hand packaged for delivery. All right, so hibiscus, that is #1. #2, we're talking about hawthorn, okay? Hawthorn. Hawthorn is hibiscus's partner in this formula, okay? Hibiscus partner, but it works through a completely different door. Completely different door. A 2025 meta-analysis of randomized controlled trials looked at hawthorn specifically for systolic pressure. That data it's barely a year old data. So as I'm recording this, which tells you how active the research is in this area still. Hawthorn's mechanism centers on the heart muscle itself, okay, and the vessels that are feeding the heart muscle itself. It's been studied for supporting healthy vessel dilation. Literally, it's helping your blood vessels widen and supports the efficiency at which your heart pumps. That's what hawthorn does, okay? You can get hawthorn berries online, but again, if you can find it all in one place, makes it a lot easier. So the other thing that it does is it does great with pairing with other herbs. So if you're on hibiscus already, you might consider adding hawthorn because they work really well together. One is opening the vessels, one is making the pump work more efficiently. And so it's two different levers, same outcome. A formula built like this covers more ground than any single supplement could, though. So like, again, if you're on hawthorn or hibiscus alone, consider pairing it with the other just to make that leverage even better, okay? So that's two herbs down, two different mechanisms, same goal, hawthorn, hibiscus. This is exactly the kind of formulation that we have put together here. All right, now, herb number three. Herb number three is lemongrass. Lemongrass. Lemongrass works through nitric oxide. And if that term sounds familiar, it should, because nitric oxide is the molecule that your blood vessels use to signal them to relax and open up. Let more blood through with less resistance, okay? It's the exact same pathway that several prescription vasodilators are designed to trigger. So there's different vasodilator prescriptions that you might be on to help lower the resistance in your blood vessels. And that's what this does, okay? That's what this does. On top of that, lemongrass carries a mild diuretic activity. So similar to hibiscus, it also is a mild diuretic. So again, if you suffer from leg swelling, edema, fluid in the wrong place, this lemongrass addition helps lower that amount of extra fluid on your body as well. So as you can see, as we're talking, we're only on herb 3, but I'm already showing you how all of these major problems that my clients have come to me with, that with the high blood pressure, with the swelling, with the stiff arteries, with the stiff heart, these are all symptoms that I sought to address in this tea, okay? It's not just a random bunch of herbs that I've thrown together. It's literally listening to what your problems have been and putting them into one place so that you can not have a bunch of herbs clogging up your counter space or your pantry space. It's all in one place, okay? And if you've followed me at all on my YouTube, TikTok, or Facebook, you see that I give you these herbs to get. I promote these herbs. I teach you about these herbs, but it's all individual products, right? Like I'll tell you about hibiscus, go get hibiscus. I'll tell you about hawthorn, go get hawthorn. I'll tell you about, so that's why I decided, you know what? Nobody's putting them all in one place. I'm going to do it. So my wife and I have created this, and it is really, really helpful for those of you trying to hit this quickly and all from one perspective. All right, so back to lemongrass. Here we go. A 2022 scientific review of lemongrass connected lemongrass to this nitric oxide driven vessel relaxing activity specifically. So 2022, they did a study of lemongrass and showed that it definitely targets the nitric oxide pathway. So some of the other vegetables and things that I've talked about for nitric oxide is like beets. If you're on beet supplement, that's the nitric oxide you're looking for, okay? Some people take nitric oxide directly, athletes and things, but lemongrass targets it naturally. So where does lemongrass fit in on the triangle? Primarily the sodium and fluid balance again, okay? So through the nitric oxide pathway rather than the enzyme pathway that hibiscus uses. So it comes at your salt and your fluid balance from a different angle. You see, all these herbs, they're coming from different angles to target all of the causes and issues surrounding your high blood pressure. So that's how you build a real formula, not just a one-trick pony. All right. Next on the list is ginger. Okay, ginger is one of the few ingredients in this formula that's been studied on two corners of the triangle separately. Meta-analysis have looked at ginger for healthy blood pressure regulation, and a separate meta-analysis looked at ginger for healthy blood sugar regulation. So remember, the 3 points of the triangle are stress, sugar, and sodium. Okay, so ginger targets sugar and your blood pressure directly with like stress. Okay, so different trials, different endpoints, same root. Why does this matter for you specifically? Remember the loop from earlier, your sugar spikes insulin, insulin drives your sodium, sodium drives pressure. If an ingredient can support healthy blood sugar response, it's working upstream of that entire chain, not just downstream at the blood pressure number itself. So that's the difference between managing a symptom and supporting the mechanism underneath it. Ginger also has a long documented anti-inflammatory profile, which matters here too. Remember, chronically elevated insulin, so insulin elevation over long periods of time, contributes to inflammation in your blood vessels, which is part of what makes vessels stiffer and less able to relax. So if you're struggling with inflammation of any sort, but especially in your blood vessels, ginger is a great, great herb. Okay. Now, I'm talking about a lot of herbs, and these are all herbs that you can get individually and use them individually for specific problems. And so I'm not saying that you have to have them in a mixture, but if you do want to get a mixture, this is a great source for that. Okay. The next herb we're at, let's see, what number is this? This is 1, 2, 3, 4, number 5. We're at number 5. Herb number 5 is nettle. Okay. Nettle is the sodium corner. All right. Sodium corner. Animal research has looked at nettle specifically for its ability to help the body clear excess sodium and fluid from the kidneys, which, if you remember from the triangle, is the exact job that pressure natriuresis is supposed to be doing on its own when your sodium potassium ratio is healthy. And all that means is that when your sodium and potassium levels are healthy, when you're taking in the right amount of salt and the right amount of potassium, the kidneys will automatically move fluid out of your system naturally and healthfully. You won't have any swelling. So if you have swelling in any part of your body, that balance is out of whack. And nettle helps to bring that back into balance, okay? Here's the connection that most people miss. It's not that nettle flushes salt out in the generic detox sense. So it's not like a water pill specifically, but research says that nettle supports the kidney's own natural salt clearing mechanism. So it works with your body's existing system rather than overriding it. So if you take Lasix or hydrochlorothiazide, your body is forced to flush fluid out, but it also takes potassium with it and all these other minerals with it rather than working with the system gently and getting that fluid out without getting rid of your minerals. Okay. So that's the important distinction because your kidneys, they're supposed to be able to do this on their own. And nettle appears to be supporting that natural process when the sodium potassium ratio has gotten out of balance. Okay. Does that make sense? I know I'm moving quickly, but I just want to cover as many of these herbs as I can in this session. We're going through 8 herbs that are in this mixture that we have put together. And it is all targeting the blood pressure triangle from different angles, okay? If sodium retention is the corner that's driving your numbers, and if you need a quiz, you can go here without the T, and take the quiz to see which corner of the triangle is your problem. But if sodium is an issue for you, which oftentimes people with sodium as their issue have the swelling, okay? They have the swelling. And so for a lot of people, if that's the dominant corner, nettle is one of the more directly targeted ingredients in this formula, okay? So nettle is for that part of the triangle. All right, number 6. Number 5. Number 5, chamomile. All right, chamomile. Chamomile tea, it covers 2 corners in one plant. There's a placebo-controlled clinical trial, which means they did a trial where some people got nothing and some people got chamomile, like in a pill, okay? And in this trial, they studied chamomile specifically for anxiety and cortisol, high cortisol, all right? And in separate trials, also people with diabetes studied for blood sugar regulation. So the stress corner and the sugar corner are targeted with chamomile, okay? Here's why that combination isn't just a coincidence. Cortisol, your stress hormone, doesn't just tighten vessels on its own. It also affects insulin sensitivity, meaning your cortisol stress makes your blood sugar response less efficient, even if your diet hasn't changed at all. So that's why I always say that cortisol is like gasoline on the fire of any blood sugar problem, okay? And the source of cortisol is stress. So chamomile is targeting your stress and your blood sugar at the same time. It's doing double duty, all right? This is also the ingredient I'd point to if you're someone whose blood pressure spikes specifically during stressful periods, a big presentation, a hard week, a family conflict, more than it does in response to what you're eating. So if stress is your corner, chamomile is something you definitely need to get a hold of. And again, yes, I am sharing this formula, but as I'm going through, if you just want to get one herb out of all these herbs and just start using that for your stress, chamomile is it. Find chamomile. It's on my showcase. You can find it anywhere really, but get these herbs in your kitchen, okay? So chamomile is directly targeting stress and your anxiety and your blood sugar section, okay? All right, lavender. Lavender, that was a surprising ingredient my wife threw in here. Lavender is the standout ingredient in this whole formula, and here's why. A clinical trial conducted specifically in hypertensive patients studied lavender for 3 things simultaneously: blood pressure, heart rate, and cortisol levels, all 3 measured together in the same group of people. The third measurement is the one that matters the most. Cortisol is the hormone that keeps your pressure elevated even when you're sitting completely still, doing nothing stressful in the moment, because the stress response from earlier in your day or in your week is still circulating. Okay. And when you have thoughts and feelings that are raising your blood pressure, whether it's something from your past or anxiety or worry, those are all creating a circulation of cortisol that drive your pressure up no matter what you do, no matter what you take. Okay. So lavender is directly targeting that circulating cortisol level. It's addressing the actual hormonal driver of the stress corner of the triangle. Okay. So, of all 8 herbs in this formula, lavender is the one that I'd call the closest to a single ingredient, multiple corner result, because the same trial captured improvements more than one measurable outcome at once. Okay. So it's actually targeting the hormonal driver of the stress corner of the triangle with measured pressure and heart rate reduction alongside in the same study. So it lowered heart rate, pressure, and cortisol in the same study. All right. Now, one thing that you can do if all you want is lavender in your life, get the essential oil. Okay. Get the essential oil, put a few drops on your pillow at night, and just allow your body to breathe that in through the night. You're going to notice a significant uh, increase in the quality of your sleep. Okay. Quality of your sleep. All right. And last but not least in this formula is calendula. Calendula. Oftentimes people confuse calendula with marigold. It's completely different. It's a relative of the marigold flower, but calendula is studied for so many benefits. It is an antioxidant support. People use it even just for skin, anti-aging. A lot of anti-aging products use calendula in them. It helps with healthier lipid levels, specifically in the context of a high sugar diet. So lipids, your fats, your processing of those is going to be targeted by calendula. So think of calendula as the vessel lining support. So the lining inside your vessel, it helps to clean that out. Remember from the sugar corner, chronically elevated insulin contributes to inflammation and stiffening in the vessel lining over time. So calendula's antioxidant activity is working on the lining of your vessel itself. And it supports the tissue that everything else in this formula is trying to protect and relax. Okay. So it's like the overseer. Everything else is widening, relaxing, bringing in more blood flow, and calendula is there making sure the pipe stays clean. Okay. It's not the loudest ingredient in the blend, but it's doing quiet foundational work underneath the other 7. Okay. So let's bring it all the way back to the triangle. Hibiscus and hawthorn work the vessel and enzyme pathways, like your ACE inhibitors and things like that. Lemongrass works the nitric oxide. Ginger bridges pressure and blood sugar together. And again, triangle, stress, sugar, sodium. That's the triangle, okay? And then nettle works with the sodium corner directly through the kidney's own natural process, okay? Chamomile bridges stress and sugar. Lavender is the closest thing to a single ingredient hitting all 3 corners in one clinical trial. And calendula protects the vessel lining underneath everything else. So 8 herbs, 3 corners, every single one earning its place in this formula for a specific researched reason. Not because it's trendy, but because it maps directly onto stress, sugar, or sodium. So if you have high blood pressure, you are a candidate for one or more of those corners being your cause. Remember, everything I teach is about causation. Find the cause, fix the cause, your problem will reverse because your body is designed to heal itself. You take 1 or 2 cups of this per day, you monitor your blood pressure, you do not stop your medications, you talk to your doctor, you say, I'm taking a tea that might start lowering my pressure. Let's monitor this together, okay? That's the conversation. That's how you work with your doctor and get off your blood pressure medications naturally. You don't take control of the situation. You work with your doctor. Okay. I'm a nurse and a naturopath. So I'm very aware of how the system works and the best way to keep both of us out of trouble. Okay. Um, so this is the 3-corner picture. All right. Again, it works alongside your provider, especially if you're on blood pressure medications already. Got to have that conversation. Particularly the one that includes hibiscus and hawthorn, those directly affect your blood pressure rather quickly. Okay. Most of these other ones are rather supportive. All right. So, all in all, always remember that genetics writes the recipe, but lifestyle bakes the cake. Remember, my name is Joel. Be your own doctor.